I'm Agnes, and I'm a breast cancer survivor. Back in the early spring, I had pain, and my pain was not a typical pain. And so I went to my doctor, and she did a physical exam and didn't find a lump. And so our next step was, of course, a mammogram. She scheduled a mammogram, and the nurse came back in and said that St. Mary's was offering a 3D mammogram. And would I be interested? And so I said, well, of course.
Hey, I'm Ashley. I'm a breast health nurse at St. Mary's Hospital. The benefit of the 3D mammogram is we're able to detect about 41% more invasive breast cancers. Also, we're able to decrease false alarms for patients, which decreases stress tremendously.
When I went through my my ultrasound and biopsy, the staff, the nurses were wonderful. They, it could tell that it was a traumatic experience for me, and they were just very comforting and just so. And Ashley was helpful with questions that I had.
We want to be there to answer questions that they have, to answer questions their family might have. So we want to look at the person overall and just lift them up and support them. Talk to them about all the positives of breast cancer. I know that's hard to hear, but there are positives, and patients with encouragement and hope will do very well in their treatment.
She just felt like that, that because of the 3D mammography, that it was going to be okay. It was everything was in a good place, and even the day of my surgery, she came in and brought a great bag of things. Breast cancer things, and she actually prayed with our family, and I felt like she was not just a nurse, that she cared.
No one wants to hear they have breast cancer, but it's our job here to show compassion, hold their hand, be there for them as support through a very difficult time.
It was hard to grasp that that I had cancer. But looking at what could have been if it had not been found so early, I'm just so thankful.
I talked to her about all of the positives. I know finding out that you have breast cancer is very hard, but trying to point out the positives and let her know she would be okay, and she was, and she will be.
I'm doing chemo right now to hopefully reduce the chance of a recurrence of cancer later in life. St. Mary's is #1 in my book. I mean, they took great care of me. They were just from the beginning to the end of my stay through this surgery, and they've just been, they're just the hospital that I would choose for anything. Both of my girls were delivered there, and it's #1 in my book. I would strongly encourage every woman to have a 3D mammogram, and St. Mary's took good care of me, and so I would highly recommend going to St. Mary's for that test.